Welcome to Medically Speaking. My guest today is Dr. Ashley Bernotis, Director of Obesity Medicine at the Kaleida Health Weight Management Center. Doc, thanks for joining us today.
Thank you for having me.
So this is a topic that has become relatively popular for various reasons in the last maybe year or so. Let's start with you. Tell us a little bit about your background and how you got in the field of weight management.
Yeah, so I am originally family medicine trained. I practiced family medicine for about 7 years before getting into obesity medicine. When I was in family medicine, I noticed a lot of medical issues that could be fixed or improved with treatment of obesity, and just didn't have the time, the volume, or the resources to do it in primary care. So I went off and specialized in it, which now allows me to dedicate my time to my patients and really help them along their journey.
Yeah, so you take your experience and you have a Kaleida Health Weight Management Center. For those who are not familiar with that, what does that look like? What is that center? Is it a program? Is it a physical location?
Yeah, so Kaleida Health had a bariatric surgical program for years located at Buffalo General Hospital, and they added me as their medical component to assist with medical weight loss not associated with surgery. And we are physically currently located at Buffalo General, but we will be expanding to Williamsville in spring of 2025. We already had a dietitian who worked closely alongside the bariatricians, but since having me come on board, we are going to be adding a second dietitian, a psychologist to help with our mental health disorders related to obesity, and an exercise coach to help our patients understand their limitations and work with them on an exercise program.
So it seems like it's pretty comprehensive. This is the part of the interview we get to brag a little bit about the program. What sets it apart from other programs that are like this out in the community?
So as you mentioned, very comprehensive. I would say that we approach this on an individualized basis. So I meet every patient, I ask them what their individual goals are, and I base my treatment plan on their goals. Of course, I do have, as a physician, I do have some goals in mind for my patients. They're mostly related to physical well-being and mental health well-being, as that's a huge component of this as well. But really finding out what patients' desires are and helping them achieve those goals is our specialty. We also, as I mentioned before, we have our surgical team, and I work very, very closely with them. So if a patient is not doing as well as they wish, or they wish to transition over to surgery or just start with surgery, we can definitely guide them right into that process. And it's a seamless process for patients. We also, as mentioned, we have a nutritionist in office, and he meets with our patients at every visit and gives them their individualized macronutrient and caloric goals to help them achieve this. And I recognize that there are nuances to all this, and every patient is going to be a little bit different with how they want to address their nutrition goals, and we work with them on that.
So you have that interdisciplinary approach to the patient and their goals. So in that scenario, are you kind of the coordinator and you're helping making sure that all those pieces of the puzzle are there for the patient?
Yeah, so they brought me in to somewhat coordinate the entire program and trying to streamline this so that it's a one-stop shop for our patients. They don't have to go to multiple sites to get their care, and they feel that we provide compassionate, evidence-based care.
So Doc, let me ask you this. So weight management is not an overnight story. Success does not come very quickly. It's obviously along the lines of more of a journey and lifestyle changes. When you're speaking to your patients, what do you tell them success looks like, or what should they be looking for when they're looking for success?
So success is so individualized. I often will hear stories of patients who struggled with their weight their entire lives. And I have personal experience in that. And so I share with them, some of my journey, and that helps them. I would say that patient success is dependent on, like I said, they're achieving their own individualized goals. And so is it to get rid of their diabetes? Is it to prevent them from having a heart attack? Is it to prevent them from needing a knee replacement? And so we work with them on that. So there's no magic secret to obtaining the results. And like I said, everyone's going to achieve different results based on their current medical conditions, on their socioeconomic situations, on their access to treatment. And so I don't promise anything, but what I do is I really work with patients and follow them very closely. And we set goals. My main goal in our office is not looking at BMI, not looking at the overall 3-digit weight number on the scale. It's really monitoring their muscle mass and their fat mass. I ensure that they're maintaining their muscle mass as they're losing their fat mass while taking either the medications, no medications, a diet and exercise program, or whatnot.
So in the past couple of minutes, we've mentioned medications, doctor appointments, interfacing with surgeons and specialists. Seems pretty pricey. Is this something that patients can expect insurance to cover? And how do they make sure that, that conversation occurs upfront so they have peace of mind there?
Yeah, so actually we accept all insurances and we bill through insurance for our visits. The only limitation would be the newer medications on the market. Some insurance plans are covering them. Some are covering them with stipulations and others are not covering them at all. And so we work closely with our pharmacy team who works with me on prior authorizations, and we know the intricacies of every insurance plan, and we help guide patients on their treatment journey based on what's covered, what they can afford. But visits with me, visits with our dietitian, obtaining mental health support and exercise as well as nutrition counseling is all covered under their insurance plan.
So Doc, along those lines, if you can, I go to my primary care doc, or maybe I don't go to my primary care doc. Do I need to be referred into your office? Do I have to go see someone before we even get to you?
So to see the surgeons, you have to get a referral, but to see me, you don't need a referral. You can get a referral from your primary care physician. I sometimes get referrals from patients' OBGYNs, but you don't need a referral to make an appointment with me. You would just go to our website and either call our office or click the button on the website to make an appointment.
That's Dr. Ashley Bernotas, the Director of Obesity Medicine at Kaleida Health Weight Management Center. Thanks for joining us.
Thank you.